I know that for most parents, it's a really challenging decision to even think about using cannabis in your child. But after all that you've been through, having a child with a refractory seizure disorder, and knowing what you've seen in responding to conventional medicines or the lack of response, I know you're watching this video because you're looking for a solution and you need something that's going to work for your child. Now, I can't promise that cannabis is going to do everything you hope, but with the right information, I know that you're going to be able to make a good decision about whether to move forward with the trial of cannabinoids in your child. Over the last 2 years, I've met with around 60 families who have consulted me to find out if cannabis is the right medicine for their child who suffers from seizures. These families want to know the basics on the risks, the potential benefits, the basic information about cannabis as a medicine, and how to use it. I want to give all this information to you right now so that you can be empowered to make the best decision for you and to consult the right provider that can help you on this journey. Let's go over the major risks when using cannabis to treat pediatric seizures. I've seen that even though these cannabinoids are incredibly safe and they usually reduce seizures, each of them has the capacity to increase seizures or the intensity of seizures in certain patients every once in a while. This is easy to observe, so if you find that your child is doing worse with cannabis, you'll notice it right away and change your plan. There's also drug interactions, so some of the anti-epileptic drugs that your child is already taking may interact with the cannabinoids. This usually occurs in the liver. The enzymes that are breaking down the cannabinoids are the same in some cases as the enzymes that break down the drugs. So they compete for metabolism, and you can sometimes get higher blood levels of the anti-seizure drugs. This is something that your neurologist should and can easily monitor through the blood and make adjustments to the dosages of those other medications if needed. The third biggest risk of using cannabis in your child is one that a lot of people don't think about. And this is losing access to cannabis. Especially if your child starts cannabis and does really well with it, and if they're able to decrease or even stop some of the other medications, losing access to cannabis can jeopardize the health and safety of your child. I've seen this happen when patients get admitted to the hospital and the policy doesn't allow cannabis to be administered. I've seen this happen when parents and families travel out of state, or even when doctors who don't understand the great potential of this medicine decide they may want to report the family to Child Protective Services. It's important that once you start cannabis, you find a way to continue this therapy for the safety of your own child. Now, besides the risks I've described, the rest of the side effects of cannabis are really quite mild, especially when compared to the rest of the anti-epileptic drugs. If you decide to go ahead with cannabis treatment in your child, it's important for you to have the right healthcare team on board. This includes a good neurologist who's open-minded to cannabinoid medicine, and likely a cannabinoid medicine specialist like myself to work together with the rest of your team. Don't just try this on your own.